I'll tell you when we are officially live.
Mm-hmm.
It's kind of weird. It's weird to see like myself in this weird live bubble when I'm just checking that it goes live and I'm like talking over there and talking over here. Okay.
Mine says that it's
Meeting is now streaming live on Facebook, so we should be live, and I'll just double check that it's officially working. Yes, we're live. Okay, great. It looks like we've got one viewer so far.
Are you sure that's not
Okay.
just
So it could be you. Okay, so I have officially taken me out of that. And I just want to double check that it's working on this side of my computer. We give people a little bit of time. Yep, we're live officially. So there you go.
great?
Okay, great. Cool. So thank you so much. It's awesome to have you here, Sophie. And like I said, this is our open space to just, talk things, pelvic floor and all the different things that we as women and as, mothers to be, or, even mothers and down the line, like I've heard stories of women, even in their 50s, not even realizing that they could have been helped earlier on with these different issues that they've encountered now since actually having children.
Yeah.
And I also came across you and Caitlin basically by chance because I hadn't heard of a women's health physio before either. So it's amazing and really appreciate you coming on and, basically having this chat with us and sharing all your incredible knowledge. We're so lucky to have you on board. So I thought I would just let everybody I'll give a bit of a run through in terms of the different topics that we'll cover. And we'd love to basically hear from you and your background. And you're just going to share absolute gold with us. I also, just for the mums who do tune in and who have sent me questions, like I said, we'll possibly cover those off at the end because we've got a number of topics, I guess, that we run through together that should answer probably a few of their burning questions within that. And so following on, we'll go. But welcome.
Thank you. Pleasure to be here. What a lovely intro.
Well, yeah. I just first of all want to tell everybody how I came across you because I think it's quite interesting, just like we said, in the fact that people don't really know what women's health physios do, which we will get into, and you can elaborate on that. But basically, I've had two children now, and with my first child, I thought I was quite prepared for birth. So I did the antenatal class that I'd signed up for, and I did hypnobirthing, and I really focused on the birth, but didn't really give like the afterbirth or the motherhood section much thought. And I guess in your profession, we all come to you because we experience issues in those areas. So you'll have like, a good insight into that. But I had Harry, who was my first 3 years ago. And then just, didn't see a women's health physio at this, 6-week checkup. I guess that's kind of what most allude to now that I found out the hard way. And did the doctor's checkup, but that was really like quick and just more about Harry, I guess, and like, are you okay, emotionally? And I think 6 weeks in, you just answer yes, even if you're not. I don't want pills right now, and if you need them, it's important. But you're just like, okay, what am I here for? Like, you don't even really know what you're there for in the doctor's checkup itself. You're just ticking boxes.
Yeah.
And then, I guess there's also this sort of, I think the 6 week is just this really interesting number. I feel like everything's thrown at 6 weeks and I don't know why.
Yeah.
But there's also this sort of notion that you should be ready to start having sex again following 6 weeks. And, you know, they do say, you know, make sure you feel right and make sure that things are okay for you before you try. But around about 6 weeks you should be good to go.
Yeah. And it's
But
like,
we're talking 9 months in for me, and I'm still like, stand away. I've got a barge pole between us still. Like, this is not cool. And thinking, why is this taking so long? There's only so much that you can, so many times that you can use, like, I'm really tired. An excuse, even though you are really tired, that is a legitimate excuse.
yeah.
But, you know, it does start to impact your relationship when it's been so long. I mean, I was pregnant for 9 months. So why is this taking so long to feel normal? Like something is wrong. So I need to seek help. And I guess with all these different things that you encounter, you naturally feel quite alone in the beginning. And you don't know if what you're experiencing is normal or not, especially if you haven't had this information beforehand. And you're not necessarily, it's a difficult topic to bring up, you know, especially with close friends, and you wouldn't bring it up with family. But eventually, you know, I decided, you know, I found comfort in opening up to my coffee group, which I think was quite good in sort of having that external group of support, because it's not directly talking to your friends about your sex life. They don't want to know. But then, you know, speaking to my one good friend in the coffee group and hearing about, she's like, have you seen the vagina physio? I was like, the what? I'm sorry, did you say the vagina physio? Like, what is that? It sounds kind of scary. It also sounds like it's exactly what I need.
Yeah.
But no, never heard of it. I have no idea what it is, who she is, what she does. And I think that was when I came across Caitlin, who's a co-owner with you at Unity Studios. And so that was really helpful, because that was my first introduction into a women's health physio, which that name just gets you straight away. It's just like, okay, cool. You know, I need help downstairs. Somebody actually exists who can help me, you know, and I can feel comfortable in talking about this embarrassing topic as such. And so I took took a trip to see Caitlin. And because I think, you know, being a first time mum, being so unsure of what I was there for, not even really knowing what questions to ask her. And I think this is why it's so helpful for, especially, you know, first time mums or, you know, those that are pregnant, to be aware of the fact that you guys exist and that they shouldn't feel embarrassed like I did in going out and seeking help. I kind of got to her and I was just like, okay, well, I've just got to talk about this one issue. I don't think I've got anything else wrong with me, because I feel fine. I look fine. I'm pretty healthy. My baby's doing pretty well, and I'm kind of on my feet at this 9-month stage, but just there's this one serious issue, really painful sex, and I can't figure it out. So Caitlin, you know, guided me through my issues and was really helpful and supportive. And I went back feeling like a lot more comfortable. I had a follow-up consultation with her. And eventually I started to understand what my body was doing and what I needed to do to help my body prepare to recover, so that we could, you know, stop being intimate as a couple. And also it was really great. I was really grateful because I had knowledge and a basis for a discussion to have with my husband about what was going on with me and what was what. And he was really understanding. And, you know, eventually, like, we have no problems now. It's great. But then come Taylor, and I fell pregnant with my second. And I went to a women's boot camp. And my friend Alice actually who was the PT and also has studied prenatal, you know, women's health. And she pointed out that I had doming. and could possibly have diastasis recti, and that I should see a women's health physio. And at this point, I didn't quite understand that what Caitlin offered was essentially a smidgen of everything else that you guys do, because I purely went to her for this is the issue. I don't think I've got any other issue. And I was about 5 months pregnant when you're doing some of the exercises, and I think I was trying to do a back bend and coming up with this Toblerone shaped tummy where my tummy basically formed this big triangle. And then realizing that that wasn't normal. But I just assumed you have a baby, your body changes, this is the new you, deal with it, because I think we deal with so much and we just believe that this is just part of us now and who we should be. So off I took a trip and I came across you. And the rest is history. So you know my history.
Yeah.
And you basically helped me get into a good rhythm of the right exercises and routines to kind of repair that splitting of the abs, essentially, which is what it is. And now I just really want to share that knowledge, and I'm so grateful that you're here to share all your incredible knowledge with everyone, because I think the key thing for me was, first of all, not feeling like I was prepared or I had this knowledge, so I didn't know about it. And I think, particularly if you're pregnant, is the best time to start seeing someone. Like I was pregnant when I started seeing you, and we continued with a plan following my birth of Taylor, which has been really helpful. And it helped me be aware of like the way I get out of bed now, the way I lift, the way I hold my breath. But also just the fact that so many of us women don't know about this and how it can really affect us down the track and cause a number of different issues, including incontinence and etc., which we can talk about. So we just struggle through so much. When you incredible experts are out there to help us, we just need to know about you and what you offer so that we can actually ask you the right questions and not be like little old shiny when I saw Caitlin, just help me with this thing. This thing. So that's my story. And now we'd love to hear from you, and if you would be happy to basically tell us a little bit about yourself, who you are, how you came to being a women's health physio, and what your passion is.
Yeah, so my name's Sophie Lax. I'm a pelvic floor physio, which is also called a women's health physio or a pelvic health physio, so lots of different names. And I'm a co-owner of a Pilates and yoga studio called Unity Studios, which is in Mount Eden in Auckland, above a restaurant called Kiss Kiss, if you've ever been to that restaurant.
Yeah, it's quite prominent, and also quite what's the word now? I've lost it.
It's quite
I was going to say, just with my history and everything, it suits it well.
So I own that with Caitlin Day, who you've already mentioned as the vagina physio. So she's, if you haven't heard of her, then she's a really good one to follow on Instagram, because she provides some awesome content. If you're pregnant or you've had a baby, you can learn a lot from the posts that she does and the Insta stories she does. So yeah, definitely worth a follow. So we set up Unity last year, which was interesting.
Just before COVID.
Yeah, so we did all this building work and the place was ready to go, and we were due to open the day one of the first lockdown, which was just hilarious. And then we ended up opening in May after that lockdown. So it was a bit of a up and down time, a little bit stressful, but then actually, funnily enough, the rest of the year was okay. Like, we have had the odd lockdown. We're in lockdown right now, obviously. Yeah. But, it's been, I think I just compare to England, and it's just been, I just feel so lucky that it's ticking along and it's become a busy studio.
Yeah, it's the same with South Africa. Just, I think with us both having family abroad, we have been very fortunate, but it's still not easy.
It's still, down, but it's just... yeah, feel so fortunate.
Mm.
But basically, Caitlin and I shared a vision of setting up a space that could have physio and exercise classes that were, you know, high quality and safe. And being both of us are pelvic floor physios, so we really wanted to set up a space that could support women throughout their pregnancy and throughout their postnatal journey, and for them to be able to do exercise throughout those times. I'm pregnant with my first baby. I'm 7 months pregnant, and yeah, I've really sort of really seen now firsthand how there aren't many exercise classes in Auckland for pregnancy. So I was looking around and I was just like, yeah, there's really not much. So that would explain why our pregnant classes are pretty busy at the studio. So no, it's been an awesome journey the last year.
Yeah.
Yeah.
And why women's health physio? Like, I think just could you kind of delve into a bit like why your passion is in that area? Because also I kind of just assumed a physio just helped you with, you know, rehab afterwards. Like I broke my arm when I was young, so I went to a physio. And in my head, physios have always just been to like fix the damage at the end.
Yeah.
And it was really interesting for me to discover, actually, hold on, you can help us prevent damage.
Yeah.
What? Light bulb.
Yeah. Yeah, so I originally started my career in London. I did the typical thing of working in a hospital. I worked in the NHS and I moved around different areas of physio. So I wasn't aware that you know, there were women's health physios that treated pelvic floor conditions. And I remember when I did a rotation in women's health, and I couldn't believe that the senior physios were doing vaginal examinations. I was just like, what the hell?
Yeah.
That's not physio. That's not what I signed up for.
Yeah.
Then I found I really enjoyed treating all the pregnant women. So you don't, as a junior, you don't go down that avenue. You
Right.
start by treating like back pain and, you know, pelvic girdle pain in pregnancy and that kind of thing, and doing Pilates. But then when I became a senior, I've always been so drawn to that specialism. My mum was a midwife. I always found everything to do with pregnancy and babies really interesting, and actually considered being a midwife myself. So I thought I would, try it out, and then realised that it's the most rewarding area to be in, and when you're looking at the pelvic floor, you know, it really is just another area of the body. It just becomes so normal to be doing examinations, and you can make such a difference, and also the things that you treat, people don't talk about. So women suffer for, you know, years and years, and then they come and
I just got goosebumps. It's so true. It's so unfortunate. Like there's so much we have to go through the suffering to almost, you know, come to life with this. And I hope that, you know, just the women that are watching this don't have to go through that. Yeah.
Exactly. So it's just, you know, these conditions are really, really common, and they're just not talked about. Like 1 in 3 women who have had a baby leak urine. So that's, you know, a huge number. You know.
Yeah, it makes me feel better in a way. I'm like, okay, I'm normal.
It's super common, but it shouldn't be classed as normal. Like, you know, the problem is that there are continence, you know, companies that produce these continence pads, you know, and they're
we don't want to be wearing diapers for the rest of our lives.
Exactly. And then they advertise them as it being like, oh, whoops, this is just what happens when you have a baby and you should just buy the pad. So, you know, that's sort of almost just showing everyone that it's just a normal thing that you put up with. Whereas, you know, it shouldn't be. All these problems are treatable. And you know, you should never, if you've got anything going on, just book in with a women's health physio, and don't ever hold back from anything you want to say, because we've heard it all.
Yeah. And it's so good. I mean, I actually had one of my best friends actually ended up helping me as the midwife to deliver Taylor, which was the most incredible moment of my life. And having her there was so special. But, you know, I had to I sort of had to be comfortable with the fact that this is my friend delivering my baby. And she was like, it's like a computer screen. Like, please, I've seen this all before. And I already felt like, okay, true, you know?
It's true. It just becomes like, you know, as a physio before going into women's health, I would treat someone's shoulder. And now I'm treating their pelvic floor. And honestly, there's no difference. It's like it just becomes like another muscle that we're used to treating. So
yeah. Because it is just so easy for us to feel like embarrassed, you know, almost intimidated in stepping foot into your area, and this is a safe space. And I think also we think the birth is all we have to worry about. Like, yes, we're going to lose all dignity in the birth, and like, okay, we'll be potentially on all fours, naked, screaming and moaning, but it's done and dusted in the birth room, and we don't have to open that door again. And I think that was one of the things that I also, a mental barrier that I had to get through, was like, oh, a vaginal examination? I thought I was done there. And, you know, I also got hemorrhoids, so I had to, which was also a fun moment, jump into the doctor's room, jump on the back, you know, lift my butt up in the air, which was not glamorous. So we come through all these different things, and we're just like, okay, cool, okay, no one told me about this stuff. I spent a lot of time focusing on the birth, but didn't realize all these different things could be classed as normal. So yeah, I think it's just opening this conversation and this dialogue, and it's amazing that you guys do have that setup, you know, dedicated to expecting mums and to mums who've been there and kind of gone through that journey and potentially suffered, and now are actually like in the place to recuperate and build their bodies into the best shape that they can be, and start living the lives that we're meant to live, and not taking it as normal for, you know, sneeze and wheeze. So it's amazing. Thank you, Sophie. So I've got a few questions that I'll just, so I might glance up at the computer screen just in front of me to kind of talk to the different topics. And we've had quite a few questions sent in as well, but like I said, we'll go through what we've got and then jump on later. And if anyone else wants to flick comments or questions through, that'd be great. But we will cover those off at the end. So can you, you spoke about exactly, you know, how you got into the women's health area. Other than, you know, could you kind of summarize what are the key things that a women's health physio looks at? Like when you say your shoulders, just like your pelvic floor, like what can you do, or what could we come to you with?
Yeah, so a women's health physio will treat.
I need a tissue.
Also called a pelvic health physio, because we treat all things to do with the pelvis. So that would be any problems with the bladder. So that could be leaking of the bladder, or getting urgency where you get a sudden urge to go and you have to race to the bathroom, and potentially leaking at that point. And just going more frequently, so having to go all the time. We also treat problems with the bowels, like constipation or getting urgency, or not being able to empty your bladder or your bowels. And then we treat a condition called pelvic organ prolapse, which is where one of the pelvic organs, so that could be the bladder, the uterus, the womb, or the bowel, drop into the vagina area. And that would cause problems or symptoms like heaviness or dragging, or feeling like something's there, like you've put a tampon in the wrong way, or a tampon's falling out, that kind of thing. And you might notice a lump down there. And then we also treat issues like painful sex, or anything to do with pregnancy. So that could be back pain in pregnancy, which is super common, or pelvic girdle pain, which is, you know, pain in the sacroiliac joints.
Is that like sciatica?
So, so you have these joints where your pelvis attaches to your sacrum. Your sacrum is this triangular bone you have below your lumbar spine, your lower back. It's where the dimples are in your back.
Right.
It's really common in pregnancy to get pain in either one of those joints or both, and the pubic joint at the front. So pelvic girdle pain is anything in that pelvic ring, so the pubic joint, or those two. So we treat a lot of women in pregnancy for their aches and pains, and then we see women postnatally for things like diastasis recti that you've already mentioned, so having a separation of the six-pack muscles, which is completely normal, and you know, all women get one.
Which again, didn't know, you know.
Yeah.
So is it, when you say all women get one, is that we naturally get it when we're pregnant?
Yeah, absolutely. So from the second trimester, you might have one. I had one super early. I mean, I'm hyper-aware. I was like, oh my God.
But you're like, I'm a physio.
Yeah, no, it's actually a helpful thing. So you have these hormones that are released in pregnancy, like relaxin. You might have heard of the hormone relaxin, and an increase of estrogen. And what that does is it causes your connective tissue to become more stretchy, so that you have enough room for the baby. If you didn't have that relaxing, then the connective tissue down the middle of your tummy, it wouldn't be lengthening, and your bump wouldn't be able to grow outwards as much. Then there'd be more pressure going down in the pelvic floor. So it is actually a helpful thing. And then postnatally, you get a large amount of recovery in the first 6 to 8 weeks. So you might not even notice you had one. Or you might notice that your tummy just still looks a bit like you're pregnant, and every time you get up from bed, it goes back to that Toblerone shape. You know, and we really need to be doing like specific core exercises that will start off really gently and gradually get harder and harder to get the core strong again. So, and it's very individual. You know, one exercise that will be good for one mum won't be good for another mum at a certain stage.
So when you mentioned just postnatally, you get a lot of recovery. Does your body naturally try to recover itself?
Yeah. So that.
And how would you know if it hasn't? Just because the Toblerone shape kind of hangs on for a while, or how long should you wait until you feel that it's not recovered and you should see someone like yourself?
Yeah. So if you imagine like the tissue, so you've got your six-pack muscles that I want to show you my tummy.
Yeah.
Six-pack muscles that go down here.
Such a cute tummy. Cute.
Then you have the connective tissue going down the middle called the linea alba. So that's going to stretch to allow more room.
Right.
And when the baby's not there anymore, it is naturally going to stiffen and come together a bit, because there is stretch and that pressure going out.
Yeah.
So, however, if you're doing the wrong kind of thing in that first 6 weeks, then you might stall that recovery a little bit. For instance, it's really important that you carry on rolling onto your side and pushing up from your side to get out of bed, to avoid that sit up action, because that every time it's just going to be pulling the muscles apart. Equally, why it's advised not to be doing any really heavy lifting, which is very hard when it's your second baby and you've got a toddler that wants to be picked up and maybe it's being a bit clingy. But it's anything where it's too much load for the abdominals, and it will cause your tummy to dome outwards, or for there to be this funny doming down the middle of your tummy. So the first 6 weeks you want to be doing gentle, just gently building up your walking and doing pelvic floor exercises and really gentle, deep abdominal exercises, and basically just trying to let that recover.
Yeah. I think is this 6 weeks. Can you kind of allude to that? I am jumping a little around what we've, put there. So I'll get back to, how we had it structured.
Yeah.
But can you kind of allude to the 6 week? Why do most professionals recommend, kind of the 6 week as the golden beaker?
So that first 6 weeks, there's a lot of tissue recovery that happens. So if you have a vaginal birth, you're going to have a lot of stretching and lengthening of the pelvic floor and the vaginal walls. Potentially you're going to have some stitches down there, and we need those stitches to heal up and for there to be no infection, the scar to be healed. And it takes a while for your uterus to contract down and your cervix to close as well.
Right.
So really that's why the doctors say 6 weeks before getting back into sex, because they don't want you to risk getting an infection. So it's but then it shouldn't be that it's like 6 weeks, go and have sex.
Yeah, because I think we look at this like figure, like, hold on, we just need to do everything, just hold on 6 weeks. And I think also like our partners are potentially like, well, the countdown's on.
So yeah, but we're really, it's 6 weeks. 6 weeks is the starting point. So that's when it's safe to, if you want to, if you're ready. Most women aren't going to be ready. Some women are absolutely fine, and like they feel, you know, they've had a really good birth and they're not feeling sore and they really want to have sex. But for most, it's going to take a lot longer. You know, after you have a baby, your estrogen levels are super low, so that means you're going to be dry and a bit sensitive down there. Add some scar tissue to the mix as well. That might be feeling really sensitive and sore. Your low estrogen will cause you to have a very low libido as well. So you just not going to feel like you want to.
Again, just feeling good about like knowing that, you know, they're hormones. There's reasons for all these different feelings that we have, because I think that in its own right can be quite confusing when we don't necessarily understand all our different hormones. And we don't understand why things are happening and why we feel the way we do. And we just start, you know, adding on this extra stress and guilt. And there are reasons behind it, which is just so comforting to know.
Exactly. And that's really, you know, you're breastfeeding and your body is stopping you from getting pregnant, you know. You should have really low at that point, you know, to stop you getting pregnant. And yes, and then you're exhausted and you have a baby attached to you and you have leaky boobs. Like, and you also don't want to get pregnant. So it's like, for a woman, sex is so mental and you have to be wanting to. So yeah, it's very, very normal for it to take a long time to get back into sex, and essentially you should just take your time and not worry about it, and see a women's health physio if you are feeling sore down there and you are worried, because it might be that the exercises that we give you help you and we will teach you as well how to massage that scar tissue, and it will help you to improve your confidence getting back into sex.
Actually, on that, can you, because it can be semi-intimidating if you don't expect this to happen when you walk through the door thinking I'm seeing a women's health physio, or physio isn't the word, you know, you don't necessarily expect that you're going to be asked to do a vaginal examination. So you're like, oh, okay, wasn't prepared for this. Can you maybe talk through, like, just so women know what to expect, if that's, you know, why you do it, what you're essentially doing, so that they can kind of like rest assured, okay, I know what I'm walking into.
Totally. So, well, one thing I just want to say first is it is an option to have a vaginal examination. It's not, you know, it's not forced upon you. And we do also look at the pelvic floor via ultrasound. So if you're not keen to have a pelvic floor check vaginally, that's absolutely fine. The ultrasound, you don't have to get undressed. The ultrasound probe goes just above your pubic bone, so you just have to roll down your trousers a bit, and you need to have a fairly full bladder, and then we're able to get a good image of the pelvic floor, and we can see the pelvic floor lifting and relaxing, and look at how long you can hold for. We can look at whether you're able to squeeze and lift up whilst you cough, and we can look at you doing the odd Pilates exercise whilst not looking on ultrasound. And it can be a really wonderful tool, because then if you're not sure whether you're doing the right thing, you can just see it on the screen lifting and relaxing.
That's amazing.
If you don't let the vaginal exammission put you off seeing a women's health physio, because we've always got that.
That's great to know. That's great to know as well.
But looking at the pelvic floor vaginally is more thorough. So you get more information than an ultrasound. So what it would involve is we would go out of the room whilst you took off trousers, underwear. You'd have a towel to lie over yourself. And then we'd come back in the room, we'd lock the door, obviously, we'd have gloves on, and we'd have a little look down there. So if you're postnatal, then we'll be looking at that scar tissue. We might just gently have a little feel of that and see whether it's sensitive. We'll have a check. We'll do a check first of all to see if there's any prolapse. So in order to do that, we might get you to cough or to do a bit of a push down. And then we're basically just seeing whether any of the vaginal walls descend down. So look at whether the bladder's dropping or whether the uterus is dropping down. We'll be able to see the cervix then, or whether the back wall is doming forwards. So we're able to check all of that, whereas you can't check that really on ultrasound. And then with gloves on and a little bit of lubrication on the glove, we'll have a feel of those muscles internally, and we'll have a feel of the scar tissue. We'll have a feel to check, we'll check whether the pelvic floor muscles are completely intact all the way around. And then we'll just go through pelvic floor exercises, and we'll make sure you know exactly what to do using lots of different cues. And we'll be able to tell how strong those muscles are, like how long you can hold for, so the endurance, how powerful those strong quick squeezes are, which you need for, you know, preventing you from leaking when you cough or sneeze. So you need to be able to, that pelvic floor to be able to lift up.
And that's essentially what your kegels are.
Yeah, exactly. Yeah. So that's what it involves. And, you know, we can stop the assessment at any point if it feels uncomfortable, but usually it is comfortable because we're just having a gentle feel.
Yeah, and I think we've been through so many before.
Yeah.
It's possibly more just the, oh, I didn't realize I had to do this again.
Yeah, totally.
Yeah.
Sometimes we'll see.
Or feel like you would want, you know, you potentially would want the thorough examination because you're walking out there knowing that you're getting all the answers, but it can just be a bit like, oh, you know.
And occasionally I will, so say if someone is really sore down there, then sometimes I'll just suggest having a little look, you know, so just doing that external look. We don't have to do the internal, and then maybe the next time we get the patient booked back in for a couple of weeks and then have a feel internally next time. So it just completely depends. We're just going to go by exactly what you feel comfortable with
and what they're feeling. Yeah, that makes sense. Yeah. You mentioned kegels, so could you kind of give us a bit of an indication as to what a kegel is? I think we don't really talk about kegels until all of a sudden we're pregnant and our midwife says, start doing your kegels. Here's an app. I'm like, okay, why now? Should I have been doing them prior to falling pregnant, or like thinking about conceiving? Is it something that we as women should just try and do naturally? You know, when we think about it, and that might be sort of tie in with the question on how do you know if you've got a healthy pelvic floor?
Yeah. So I'm going to get my pelvis model out for this. Because I find it's much easier to
Oh no, I love this stuff. I think it's really exciting.
You can see. But
does it have a name? You should name it.
Doesn't know.
Oh, you have to name it. We'll have to come up with a name for it. Susie or something. Sorry if there's any Susie online. Just the first name that popped into my head.
So this is a pelvis. So I'm just going to go over the bony anatomy first. So this is the pubic joint at the front of the pelvis. These two bony bits at the sides, that's where you've got your hip bones at the front, at the sides. So that's where those bony bits are. And then looking at the back, you can see there are these two vertebrae here. These are the two lowest vertebrae of the lumbar spine, so that lower back. And then this is the bone I was talking about earlier, the sacrum. So this triangular fused bone. And then you've got the coccyx right at the bottom. So this little bone right down here that you can barely see, sorry. Now, these two joints here are called the sacroiliac joints. So that's where your sacrum attaches to your pelvis either side. That's where you have those dimples in your lower back. So that's your pelvis, which is like a ring of bone. If you look down the pelvis, that whole red area is your pelvic floor. So it's a really big group of lots of different muscles that work together. And then if you look up at the pelvis like that, you can see that the muscles go around each passageway. So they go around the urethra where the urine comes out, around the vagina, and around the anus at the back. And the muscles are a bit like a kind of diamond shape. So they go from your pubic bone at the front to your coccyx, And then to both of these bony bits either side, the sit bones. So those are the bones you can feel when you're sitting.
Sitting, yeah.
Your bum either side.
You're told I've got a bony bum. Yep. Those ones.
So in order to do an effective pelvic floor squeeze, we want to get that whole muscle lifting. So we want to definitely squeeze around the back passage. So that would be imagining that you're stopping passing wind. So a squeeze and a lift. And then also imagining that you're stopping passing urine or lifting up a tampon. And you want to get a sensation of closure around those passageways, and then a lift. That's what we're trying to get. So that kind of squeeze and close, a lift. Then we want to get a full relax back down, and almost like a sensation of opening or widening at the bottom. So when you're doing pelvic floors, it's not just about squeezing and lifting up. And that's where I think some women go wrong in pregnancy, because they focus so much on that squeeze, and they might be doing them like 3 times a day, squeezing, squeezing, squeezing. And then the muscles can get a little bit tense and tight. And that's what we really don't want for delivery.
Yeah, it's really hard because you almost think that you're doing the right thing, and it's you're going against that. Yeah.
So that's the thing. It might be that you've always struggled with pelvic floors. Like if you've done a Pilates class in the past and they say, you know, squeeze your pelvic floor, and you're just like, I don't know what I'm doing. You know, we see a lot of women that have never been able to connect to these muscles. But that's what we're trying to achieve. We're trying to get that good lift, that full relax, because that's how the muscles work. So when you're going about your day, you're lifting up children, those muscles are supporting and lifting up. When you go to the toilet and you sit down to empty your bladder, the muscles completely relax. When you have sex, they relax. So it's, you know, that is how, imagine the muscle a bit like a jellyfish. So it's kind of lifting, it's like throughout the day. So we don't just want to work on that squeeze, we want to also get that coordination. And your pelvic floor, it's got lots of different functions. So the muscles are supporting all your abdominal contents. So that's like lifting up your bladder, womb, bowel, and all your abdominal contents, everything up inside you. They're also really important muscles to keep you continent, so to stop you from leaking urine or feces. And they're part of your deep core. So they're a very important muscle for your posture. They work together with your deep abdominal muscle, which acts a bit like a corset. I'm going to stand up again. So it acts a bit like a corset going all the way around from your back, attaching to your ribs and your pubic bone. So when you do a pelvic floor squeeze, you should see that lower tummy draw up and in. Or if you're pregnant, you should see your bump draw up and in. So that's just your core working together.
Yeah, I remember our exercises were so helpful when you helped me, you know, stand in front of a mirror, and I could actually kind of concentrate what I was doing and see that. And that just helped me remember, like, okay, this is how I'm doing it. Now I know I'm doing it right. So I think just really getting that extra help, you know.
So super important part of your deep core. So supporting your pelvis and your back, and then the pelvic floor is also a really important muscle in order for you to have pleasurable sex. So loads of different functions, and that's why it's so important to maintain the strength during pregnancy and to get the strength back in your pelvic floor postnatally, because you might not have symptoms initially, but then maybe with your second pregnancy or down the line when you hit menopause, that's when you might start to really get symptoms, because these muscles have just been weak for that whole time.
Have you got any sort of examples or stories to share where women have actually only realized, like, later down the track and gone, actually I need, you know, I could have had this help but I didn't realize, and how, you know, for no one to feel like that it's too late. I think that if you've got the opportunity to see someone straight away, it's never too late. But how does it, how would you work with these women, and how can you help them? And
so we do see women, we're fortunate that we see a lot of women coming to see us, you know, when they are pregnant with their first baby and postnatally. I think just through Caitlin's amazing Instagram, she's managed to capture a lot of women in Auckland, and they sort of prioritizing their pelvic health in pregnancy. So we're very lucky, but we do see women who come in after their third baby, or, you know, they've got kids that are aged like 9 and 12, and they've been dealing with stress incontinence, or and it might be just what they've considered as normal because they've been living with it for so long. So it could be that they've just adapted their lifestyle. They're like, it's not too bad, I don't leak that often, but I avoid trampolining, and, you know, I don't jump the trampoline with my kids, and I also haven't been able to run since I had kids, and I kind of leak a few times a day. And it's like, actually that lifestyle's been really it's been really altered because of those symptoms. And with something like stress incontinence, so stress incontinence is where you leak when you either cough or sneeze or laugh or do something strenuous. So it's like anything that increases the pressure on your tummy, that pushes down on the bladder and the pelvic floor. And that can be caused by just having a weak pelvic floor. But it can also be caused by having some lengthening of the connective tissue that supports the bladder. So your bladder is, you know, pre-pregnancy, if you imagine your bladder and your uterus and your bowel are just being supported in their sort of perfect position next to each other by connective tissue, so fascia, ligaments as well, holding them up. So even just pregnancy and the changes in that massive stretch as your tummy grows can cause a slight change to where those organs are sitting. But then having a vaginal birth can mean that your bladder just isn't as well supported. So when you cough or sneeze, your bladder's moving. Does that make sense?
Yes.
So it's, yeah.
I'm like, well, this has happened to me a few times. So now I'm going, you know, I've just literally been sitting on the couch watching a show, had a little cough, and I didn't know I needed to go to the bathroom.
And so, yeah, it can literally just be due to, you know, weak pelvic floor muscles, but it could be, but it's really important to see a specialist. So like see a women's health physio if you can, because we need to establish whether it is just weak pelvic floor muscles or whether that bladder's just not being well supported, because you can actually have a strong pelvic floor, but the bladder's moving.
Interesting.
Because of the
Can we touch on C-sections as well? Just because a lot of women and a lot of the discussion that we've kind of had has been vaginal birth related, but also if you've had a C-section, most of it, and potentially some women kind of assume that it's all happened up there, so they find downstairs.
So,
can you kind of give us some insight into that?
Having a C-section, well, actually, first of all, touch on, so having a weak pelvic floor definitely is caused, you know, by childbirth, but it's also caused by pregnancy. So you're not let off from your pelvic floors just because you've had a C-section, even if it's
that might be one of those aha moments.
So what happens in pregnancy is, you know, we've talked about the hormones. So the hormones making your connective tissue more stretchy, which means that your pelvic floor becomes more lengthened and stretched during pregnancy. And then you've got the weight of the baby on those muscles. So even if you have a cesarean, your pelvic floor is probably going to be a little lengthened and a little weak. Now, we also do see a lot of women who have had cesareans who have a slightly tense pelvic floor. So I've more and more, as I've become more experienced, I've done a vaginal examination, even, you know, if I'm suspecting after a C-section that they've got a tense pelvic floor, because they might be complaining of, you know, having painful sex or struggling to empty their bladder because those muscles are so tense.
Wow.
So it's not just about, you know, we want to get those muscles coordinating well again. So that's not just about the lift and the power, it's about that relax. So yeah, it's still really important. Even if you're pregnant and you've been told you have to have a cesarean, you still should be doing your pelvic floors in pregnancy.
I love that, Sophie. I feel like it's just like we need these little nuggets, you know. I just wish that every woman could actually just have this in the back of their brain, or at least, you know, those that are watching this share that knowledge, kind of just, we just don't know what we don't know, you know, and the more information we can spread about this, then, you know, hopefully just stop that, prevent as much suffering for women going forward.
And it's much easier to train your pelvic floor before you've had a baby. So and even easier still before you get pregnant. So if you're thinking about having a baby and you've never been able to do a pelvic floor squeeze, then book in with a women's health physio, even if you're not having any symptoms, just to really be taught how to do these exercises properly. Because once you've, say you've had a vaginal birth, your pelvic floor is going to feel very different compared to how it felt in pregnancy, because the muscles have to stretch to 2.5 times their length in birth, which is incredible. Wow. No other muscle in the body can do that without completely failing. So
wow.
Yeah,
that's really interesting.
Yeah, so if you have never done a pelvic floor squeeze and then you have a vaginal birth, it's going to be 10 times harder to do that squeeze afterwards. And 30% of women who just read about how to do a pelvic floor squeeze on the internet, say, or from a leaflet, 30% will actually...
Or an app.
Yeah, or an app. Yeah, they'll actually be bearing down or pushing down, which is going to make symptoms worse. So yeah, so it's, if you can in pregnancy, so great to see a women's health or a pelvic floor physio, so that you learn exactly how to do a pelvic floor squeeze well, know exactly how to relax those muscles, and then if you continue doing them throughout pregnancy, the guidelines advise doing them a few times a day. Then postnatally, when the muscles feel really different, you might not be able to feel them, but then you know exactly what to do, and you have that muscle memory and that brain connection. So you can start doing just a few squeezes a few times a day, and then gradually over the first 6 weeks, just build that up.
Yeah, it's really interesting with that muscle memory and how much it actually works. You know, you kind of just, it's just like, I guess, driving a car or riding a bike. You sort of just, it becomes natural. You don't need to think about it anymore. And so hopefully, like, through those pelvic floor exercises, once you know exactly what to do and how to do it, it'll just feel so natural. So yeah, I think that's really helpful, because so many of us just don't know, you know, that you guys exist or what to do or how to do it. And so if we can kind of bring women on when they're, you know, pregnant or even thinking about having a baby, then this journey will just be that much, hopefully, easier for them, or, you know.
And I thought I'll just mention that, so when we see women in pregnancy, we see them for a prenatal warrant of fitness, which is a 45-minute appointment, and we'll talk a lot about the pelvic floor. We'll do a ultrasound of the pelvic floor to see whether those muscles are working well, and we'll also do a lot of birth prep. So we'll talk about breathing techniques to relax your pelvic floor for labour, and how to do perineal massage. So to prepare perineum, which is advised in your first.
Yes, I'd actually forgotten all about perineal massage, which is so it's so helpful. I was like, that's this thing that I've got to do, like all these things that you hear from your midwife. Start doing your kegels and your perineal massage, and you're like, oh, why?
Yeah, it's not a you know, fun thing to do, but it can really help women to improve their confidence going into birth. So you want to make sure that your pelvic floor is able to relax easily, and for you to be able to breathe and allow the pelvic floor to relax even when you're in pain. So that's where I think the perineal massage is really effective and helpful. It's yes, it's to get a little bit of stretch on the perineum and the pelvic floor muscles, but it's really for you to feel that sensation of stretch, being able to breathe and relax your pelvic floor whilst you're getting that sensation. And then when you go into delivery and you're getting to that crowning point, hopefully you'll feel a little bit more confident, because you know a bit what that's meant to feel like and how to relax in that moment.
I also, sorry.
No, carry on.
Oh no, I was just thinking, you mentioned, breathing, and I think it's so important, just like how you're focusing on, like you talk about the jellyfish, like you do that, you're feeling that with your muscles, but it's also just the breathing and how you help me with the breathing with my diastasis recti, postnatally.
Yeah.
There's so much breathing that we concentrate on, going into labor, and potentially we've done hypnobirthing classes and that kind of thing. And we sort of forget that the strength behind those breathing techniques can be applied after birth as well.
Yes, absolutely.
And how helpful they are with, encouraging you to feel your muscles, and particularly like with the diastasis recti, what you helped me realize is, like breathe in and hold it when I'm going to lift up something. If I have to lift up my heavy toddler, just breathing and holding and strengthening my muscle in that case, before, and then relaxing and putting them down. And I'm just a lot more aware of doing those sort of things now, and I can honestly feel like I've definitely felt a difference.
Good. Yeah. So so when you're so I'll just talk a little bit about how breathing affects your pelvic floor. So when you're when you take a breath in, your diaphragm contracts down, and that increases the pressure in your tummy. Your tummy muscles are going to go outwards, and your pelvic floor lengthens and drops down. So if you imagine your abdomen, your tummy is a bit like a canister of pressure. And so diaphragm contracts down as you breathe in, pelvic floor lengthens and drops down. And then as you breathe out, diaphragm goes up, pelvic floor recoils and lifts back up again. So that's what's happening all the time. So it can help when you're lifting up your kids, if you're getting any symptoms, or if you're getting back pain every time you lift up your child, or heaviness, or leaking, or any symptom like that. Actually just doing an exhale as you lift, because you want the pelvic floor and the lower tummy to be drawing in, or even doing that pelvic floor squeeze or that lower abdominal connection, drawing those in, can help to support you. But it can literally just be an exhale, because if you think about what's happening as you inhale, you're breathing in, and there's going to be more pressure going down on the pelvic floor.
Yes, actually, that's it. Sorry. I feel like when I don't have my toddler on me, but like when I'm doing it, then it like naturally comes when I'm trying to think about what I'm doing without him. And it's like, hold on, what am I going to do?
Yeah. So it's the opposite.
Yes, exactly. I was like, oh, yes, that's right. I'm just trying to like pick him up here to get that feeling again.
Yeah. So we teach how to manage that kind of increase of pressure in the tummy for most women. So in pregnancy, and for anyone that's got prolapse or any incontinence, it's a really helpful thing, and quite simple, just to always think about that exhale.
Yeah, it's just incredible to realize that, you, like you said, women's health, pelvic floor physio, essentially the same thing, just two different names. No?
Lots of, I'm just saying, we all call ourselves slightly different things.
Okay, phew. I was like, I haven't confused myself further, have I? Yeah, because I think that's it. We've got, women, we've just had someone tune in from Cape Town actually as well, who's been watching us. So potentially they've got different, terms back in South Africa or the UK or New Zealand, or wherever you may be in the world. So what you should be Googling in your area essentially would be, women's health physio, pelvic floor physio, or and just realizing that it's the whole pelvic area that you can help with, and that you can help with, all issues from like incontinence to painful sex. One topic we actually haven't touched on briefly is hemorrhoids. Like we spoke about prolapse and that feeling of that heaviness. Are hemorrhoids the same thing?
So hemorrhoids are to do with the blood vessels in the anus. You can have hemorrhoids that are like swollen blood vessels that can either be external, where you'd see a lump, or they can be internal, and typically caused by you know, childbirth is a big one, or pregnancy, being constipated in pregnancy, childbirth with all of the pushing, and having poor bowel habits where you're straining on the toilet or spending a long time on the toilet, also can just be caused by being overweight, or doing a lot of repetitive lifting or strenuous lifting where you're not controlling those pressures well, so you're bearing down a lot. And the symptoms are getting a bit of bleeding. So when you go when you have a bowel motion, you have a bit of bright red blood that you might notice on the tissue. It might be painful to go as well, but it can just be that you get the bleeding. And it's always worth, if you're getting that bleeding, to not just think, oh, it's just hemorrhoids. I would always speak to your doctor, to your GP about that. And the things to look out for, sort of warning signs, would be that it's not that bright red blood, it's dark blood actually in the stool. So that's a warning sign. You definitely need to go straight to your GP to talk about. But hemorrhoids just not pleasant, and definitely you need to see your GP for your doctors to help you with those. But initially, postnatally, if you're really uncomfortable down there, then you're going to have to do a lot of sitting to feed. So just making sure that you're in a comfortable position. You might have 2 pillows that you might want to sit on with like a gap in the middle, so that there isn't that pressure on the back passage. Or you might want to consider lying on your side to breastfeed your baby. Or there are these cushions that you can get as well that have a kind of gap around the sort of perineum.
Are you talking about the donut cushion?
Yeah, there's a donut cushion. Yeah, and then there are ones that are almost like a kind of square that sits on your chair, but then with this foam, but then there's like a big gap. Not that you can see that from the outside because it's just, you know,
covered.
But basically it's just to avoid, it's to make you more comfortable sitting if you're having to sit loads.
Right. Yeah. It's quite phenomenal, in fact, that there are so many different devices out there. Also, just with the me seeing Caitlin discovering vaginal dilators. And realizing that, again, you know, just by having a consultation with you guys and investigating exactly what your issue is, all these different tools out there that you can essentially adopt, and these exercises that can help you with your specific issue, because everybody is so different when they come to see you with what they've gone through and what they're going through at that point in life.
Absolutely. And there are lots of different devices. There are ones that help.
Sorry, so if you've gone a little bit quiet, have you?
Hello?
Yes, we can hear you. You just went a little bit silent in the background. I'm not sure if it's
Is it better now?
Slightly.
Yeah, hang on a sec. Let me just. It's getting really hot. It's probably getting a bit hot.
Is there something in front of your microphone?
No.
Oh, there you go. Maybe it's just because you were further away.
Is that okay now?
Yeah, better.
Yeah, sorry, just let me know if that happens again. It could be just.
That's okay.
I don't know. What was I saying? So yeah, there are lots of women's health devices that can be helpful. They're not the be all and end all. It's not that you, in order to get a strong pelvic floor, you have to like buy something. But in some instances, say for instance, you really struggle to feel your pelvic floor. So as in, like, every time you do a squeeze, you can't feel what's going on. Then there are these pelvic floor devices that you can pop something into the vagina, and then you can Bluetooth to your phone. So it's like an app.
Wow.
And then you can be doing your pelvic floor squeezes whilst essentially like doing a computer game.
Oh my gosh.
There are things like that. So there's the LV, there's the PeriFit. So there are different devices like that. And then there are, as you say, like dilators. So there are things that we can use in order to help to lengthen the pelvic floor. But really with that, when the pelvic floor is really tense and tight, it's a lot to do with learning how to relax those muscles yourself. Maybe doing a little bit of massage on any scar tissue you have. And it's so much, the pelvic floor is so linked in with the brain that if you're tensing down there too much, it's usually we've got to train you from up here to learn how to relax.
Wow.
Before going down the route of using something like a dilator. But although dilators do have their place, we want to get you to
encourage the natural
first.
Yeah. Oh, that's pretty amazing.
Yeah.
Everything you've shared with us, I'm just like mind blown, you know. It kind of just opens up so much. You know, you just feel like you go in and you learn as you go, I guess, especially when you're encountering all these different areas of motherhood. And I think it's just incredible that hopefully, you know, more women will be able to come and see you guys, women's health physios in general, you know, when they are thinking about, you know, that step to have a baby, and knowing that just in the back of their mind, you know, when they are pregnant, like just see someone in advance, because like you can feel fine. And then issues can crop up, just like the diastasis recti with me. I potentially didn't fully recover properly after my birth with Harry, or I did recover and think I was fine, and then, you know, it naturally happened with my daughter, but it was actually quite bad. I'm not sure from memory if you can remember.
I remember we did lots of lovely one-to-one Pilates sessions.
And
I remember
I remember you saying that tummy and helping me like bring it back in, and so I don't know whether that potentially was just me not recovering from my first, or
it's the thing is you know, you're more likely to have issues with your second baby because things already have to stretch once. So for instance, as an example, we see women in their first pregnancy that might come and see us in their final trimester for pelvic girdle pain. So that's where you get the pain either in the sacroiliac joints or the pubic bone. So they might come and see us at week 34, you know, or something like that. And then we're treating them and getting them more comfortable. But then with their second, they're coming in week like 14. It's because, you know, most women with the best will in the world, you're not going to get yourself as strong as you were in your first, you know, before your first baby. So say you really enjoy doing exercise and you exercise during your first pregnancy, you're keeping yourself strong and flexible, and then postnatally you haven't had the time to go
because you have a toddler.
Just don't.
Well, a baby first of all.
So then you go into your second pregnancy not in the same not as strong as you were with your first, with no time to really be going to these classes or, you know, doing exercise for yourself, whilst lugging around a toddler. So that's so we'll see that, you know, first pregnancy was absolutely fine, but then there are problems in the second one. So it's nothing that you did wrong. It's just that you probably had a bit of a diastasis after you had Harry. That didn't really cause you any problems, but then that's going to potentially it's going to come on a lot sooner and be worse in your second pregnancy. So you have to really be thinking about how to manage it. So I wouldn't say.
So for us busy mums with little ones running around, what's the best thing that we can do if we are struggling to get out and get to a class, or is it seeing, you know?
Probably to see a physio to get a really targeted, you know, personalized exercise program that you can fit in. So it might be that we give you 2 exercises to do every day that will just maintain the strength of the muscles that you need to support you. So if that's, you know, if there's just no you know, you're so busy all day and there's no way to be getting to any kind of class or to be doing anything online, just knowing that you've got a few exercises to focus on might be the easiest way to keep symptoms at bay. There are lots of
because you do have online classes as well. Because I think for me I'll be tuning in at like 10 p.m. because still trying to get them down is so bit of a nightmare at the moment, especially with daylight savings. I thought I used to love it prior to having kids, but now I'm like, no, it needs to get dark. Not even my blackout blinds are helping enough. Get dark.
Yeah. Yeah, so yeah, generally exercise around sort of childbearing years, exercise that can be really helpful would be things like Pilates and yoga. So when you're pregnant, your pelvic floor gets a bit weaker, your deep abdominals get weaker, you have big changes to your posture because your bump pulls you forwards. And potentially you might have some weakness just in your glutes, for instance. So Pilates is a wonderful exercise that you can do in pregnancy to maintain the strength of all of the muscles that are getting weaker. And then it's a wonderful form of exercise to do postnatally, because we want to get all those muscles strong again. We don't just want to like race back into running or strength training without working on the deep posture muscles. So that's why a lot of physios teach Pilates, because it's just so helpful.
It makes sense. You spoke about running as well, and I think a number of women who are potentially are quite into their fitness and are, you know, potentially marathon runners or have been running prior to having baby and then kind of take it slowly when they're pregnant and then get back into it, and who might, especially when when you've had baby, it's your number one thing is to try and get out, get a breather, get some fresh air, you know, take some time to yourself. When would you what would you sort of say to women who just want to, you know, jump back into exercise?
Yeah, so there are some guidelines that are just like general guidelines. So everyone's going to be different, but as like a general rule, they advise from 6 weeks postnatally to be getting back into low impact exercise. So that would be like your Pilates, yoga, swimming, cycling, you know, that kind of thing. And then from 12 weeks minimum to be getting back into anything high impact like running or doing weights in the gym, etc. But really 12 weeks is like, again, it's a bit like the sex thing at 6 weeks. It's kind of the starting point, and you should only really be resuming those forms of exercise if you have worked on your pelvic floor strength and your core strength, and you've worked on just generally strengthening the muscles that become weak in pregnancy. So
and that's regardless to what type of birth you've had as well.
Yeah, it is regardless. Like, I mean, but then it is going to impact like how that birth was. So if you had a really uncomplicated vaginal birth without, you know, really any tearing, and you didn't have any symptoms afterwards, and then you did your pelvic floor exercises 3 times a day, like that person is probably going to be fine for getting back into running at 12 weeks. But the reason why we want to wait that long until that 12-week mark is that there's a lot of tissue recovery that happens. So the vaginal walls that have lengthened, you know, you're going to get a lot of recovery of that tissue. The pelvic floor is going to strengthen up. And also hormones play a really big part. So
I think we also forget about hormones, because we forget about how we're feeling and how and just we just assume like we feel okay, but we forget that there's all this other stuff going on as well that affects us physically, which is crazy.
So you remember the pregnancy hormones that cause all of your connective tissue to be more stretchy? Well, the effects of those can last for 12 weeks postnatally. So you know, so that's why if you were to go back to running at say 5 weeks or 6 weeks, you're much more prone to injuring yourself or causing yourself a prolapse or worsening of any pelvic floor symptoms you've got, or hurting your back or your knee. So you're just going to be so much more prone, and your estrogen levels are so low as well, making you more prone to injury and joint pain. That's why those guidelines are in place. But there are some wonderful return to running guidelines that have been written by 2 pelvic floor physios and 1 running specialist physio. And they advise being able to do there are like 4 tests that you need to be able to do well in order to have good form getting back into running. So these are all tests like being able to do a single leg squat. So that's like when you are balancing on one leg, putting your bum back.
Yes. I don't even know if I could do that.
Yeah.
I'm not ready.
Yeah, and you've got to do them well with good form. So
Right.
20 repetitions. So it's,
who are those 2 physios? Would you be able to maybe send them through, and I can always post later?
Yeah, I can. So would it be helpful for me to like post some, or I can
Yeah,
send.
you're welcome to post in the group yourself. Go for it. Yeah, that'd be great. Thank you.
But yeah, there's 2 physios, Grania Donnelly and Emma Brockwell, and then Tom Goon is this running physio guru. So yeah, and they're really helpful guidelines. And you kind of have this like things just to tick off, you know, being able to do your pelvic floors in standing with no problem, you know, being able to hold for a long time and having a powerful squeeze, being able to do things like a plank, and then these exercises that would basically strengthen up your glutes and give you good form running. And it's much better to take things slowly, to take longer to get back.
There's probably a bit of a method in terms of how you pick up your running as well. Like you say, you possibly pass these tests, and then you probably have, you know, like, well, how far can you run at this pace, you know, and just taking your time.
Taking your time with it, yeah. So it might be that you go out for you know, 10 or 15 minutes first of all, but then you're running for 1 minute and walking for a few minutes, running for 1 minute, walking for a few, and then the next time you go out, you run for 2 minutes and walk for 2 minutes, and it, you know, you can gradually build it up like that. And you know, walking can be, if you're going out for a run walk like that, walking can be really good exercise if you've got some hills near you. So you know, you can just be like powering up a hill walking and still getting like really puffed, which is going to be low impact. So yeah.
And when you're pregnant, and I guess there's some, you know, depends on where you are in your pregnancy, but I'm possibly thinking more, you know, towards the end, reaching the end of your pregnancy, you're wanting to almost walk up those hills just to like move baby down and move. Is that causing, that's not really causing any damage, is it? Because that's going with like, you know, gravity and trying to help baby out. That's not the same. It's not, you know, it's more the recovery afterwards.
Yeah, no, walking during pregnancy is also always great. No, not something you need to avoid. I mean, generally exercise in pregnancy, there are some exercise guidelines as well that I'll send to you about what things are good to do in pregnancy, and it kind of changes throughout the different trimesters. But there are these guidelines that advise doing 150 minutes of exercise per week. So that breaks down to about 20 minutes a day when you're pregnant, and a mix of doing aerobic or cardio and potentially some kind of strength training, which could then be Pilates or lifting light weights or something like that.
That's really helpful. Yeah.
So and then it's going to change throughout your trimesters. I don't know about you, but my first trimester, I was horizontal from 6 p.m. every night. Did absolutely nothing.
It was very different with my pregnancies. The first one, I actually was fine. I was like, what is this thing, this morning sickness thing? I'm okay. I think I had like one weekend. I was very lucky, where I pretty much was like, didn't move for a whole weekend, but it was very random. And then second pregnancy, it just felt like, I think I actually had the morning sickness in the late afternoon. And then I would just be like, I don't want dinner. Don't look at me. Don't talk to me. I don't want to smell anything. I'm just going to sit here and drink my ginger tea.
I just felt like I've actually felt throughout my pregnancy really dizzy. I've got very low blood pressure, but that first trimester I felt very nauseous and dizzy. So I mean, God, the thought of doing exercise, there's nothing I could.
Was like, no.
But if you are feeling fine, you can just carry on with your normal exercise routine in the first trimester. You don't need to stop exercising. Exercise is fantastic to do in pregnancy, and if you can, you should continue. But when you
is that different with different types of exercises, and maybe like potentially, yeah, because
Yeah,
I think
so yeah.
I've heard with yoga they sort of advise against exercising in the first trimester.
Well, the thing
Or is
about
it
the
just
first
different for everybody,
trimester,
and, you know,
yeah,
seek a professional?
yeah, the thing about the first trimester is that it's, you know, there's a very high chance that you're going to have a miscarriage. You know, 1 in 5
Yeah.
women might end up miscarrying.
Mm.
So if you're if you're used to doing a certain type of exercise and you're feeling fine, then you're fine to continue, because that's just what your body is used to. So if you're
Right, okay, that makes a lot more sense.
running, having said that, you're not going to be trying to go for your personal best. You know, it's not the time to be really competing or trying to like really progress your fitness and increase fitness. It's a time for maintaining. Now, we'd advise that if you're completely sedentary and you've never exercised, then the first trimester is probably not the time to be starting an exercise routine, even though it's wonderful to do exercise in pregnancy. But you probably should just wait until you've had your 12-week scan before launching into something, because it could be too much stress on your body and potentially could lead to a miscarriage. So it's just, but if you're used to exercising, just carrying on, you pretty much
doing what your body's actually used to doing, because it's possibly that muscle memory there as well.
Yeah, totally.
Yeah.
And things that you would always want to avoid in pregnancy would be like exercising in a really hot environment. So you wouldn't want to do Bikram yoga, like that hot yoga. You wouldn't want to be doing contact sports or anything where you could fall. So avoiding things like skiing or cycling on a road, potentially dangerous in case you got hit.
Generally.
Yeah.
Yeah.
And and avoiding things like scuba diving and bungee jumping.
Yeah.
You know,
Yeah. I've done the
Yeah.
bungee jumping once, and I'm like, that's me, done, dusted, ticked. I actually did it with my husband, and I like cried the whole way down. We did a tandem bungee jump, and I literally cried the whole way down. I was like, when is it gonna end? You've just brought up nightmares. But yeah, I've just kind of been glancing over the different things that we've covered, and we've covered heaps. I mean, we've covered so much in terms of, you know, from all the different, you know, basically what a woman's health and pelvic floor physio is, you know, when to see one.
Yeah,
kind of understood the 6-week beacon, which is, you know, and the 12-week beacons. In terms of, you know, what that means in terms of getting back into exercise, you know, and when to have sex and see your checkups, and really understanding that those are just guidelines. And like you say, it's more from the start, and then looking at how you are feeling and what's happening to you. And understanding that we can actually, you know, source out your help and expertise. You know, best time to do it is when you're pregnant, so that you can actually have a prenatal warrant of fitness. I didn't realize that was a thing. I didn't even know about the postnatal warrant of fitness, but now I'm like, what? That's so cool. 2 for the price of 1. Kidding. But you know, that whole fact that you're there to help us on the entire journey, you know, so from the start through the postnatal phase, and just the different things that can crop up, you know, from painful sex and incontinence, you know, understanding that the pelvic floor is everything that you look at there, you know, so it's not just, so if you are having any issue downstairs with anything, that's when we can phone you and come and, you know, have an assessment. And understanding what kind of assessments you do, you know, like understanding the vaginal assessment if you're comfortable with it, or the fact that you can actually also use an ultrasound to monitor those, understanding kegels and what they are, and, you know, how best to use them, the different tools that are out there when we've got specific issues. I think we've just, you know, covered so much different exercises that we can do, you know, from being pregnant to postnatally, and when's the best time to like get back into that exercise regime and understand what exercise is best for us with our specific issues. and yeah, we've spoken around, understanding that the jellyfish. I love the jellyfish. I'm gonna ask, do you know about your jellyfishes? That's what I'm gonna say to people. Do you know? These are the squeeze and lift. Think of the jellyfish. That's gonna be my thing. And yeah, we've covered so much. I think everything that we've kind of spoken about within this, we've covered most of the questions. We have a few personal questions. One, we did discuss, how if you've got a healthy pelvic floor or not,
Yeah.
How do you know if it's not overactive or weak?
Yeah. So it would be
exactly say that.
So if you've got an overactive or a tense pelvic floor that isn't able to relax properly, then you could have symptoms like back pain. You could get pain when having sex, and pain, if those muscles are tense and not relaxing, it'll feel like you can't have any kind of penetration. So any kind of penetration, that could even be having like a cervical smear, so a pap smear. Anything where something's going into the vagina, it's going to have to stretch those tissues that are hanging on. And then it can also, having a tense pelvic floor can also cause you to struggle to empty your bladder and to be straining and pushing down to empty because those muscles just aren't relaxing enough.
Is that like, okay, potential personal question here, putting myself in the consult room. If you're sitting on the bathroom, sometimes it can take like 15 minutes to pee. And I'm like, I know I need to go. Why is it?
So do you mean you hesitate?
No, I don't hesitate. It just doesn't happen.
So as in you get there and you know you need to go, but you can't start?
Yeah.
But I mean, that can sometimes be that the pelvic floor muscles aren't relaxing, potentially.
I'll be coming back, so.
Yeah. Come back.
We'll take this offline.
Yeah, it can be that, but it can also be if you're going too frequently. So say if you were going all the time, and the bladder's
I know it's not the fact that I get to go all the time because I'm running around toddlers and whatnot, and I'm finally like, yes, I've been holding onto this pee, I've got to go, and then it just
sometimes takes a bit.
I'm like, okay, do I need to sing to myself? Do I need to put the water on?
Yeah, running tap might help.
Yeah.
But also just, in that moment, doing a bit of breathing. So breathing into your tummy, and then as you exhale, just imagining your pelvic floor is just melting down. Just see whether it is.
It's probably just potentially tense from like running around and that overactive of like feeling like you're on the go the whole time.
Yeah,
like,
essentially.
Yeah.
So, but yeah, we can talk about that.
Yeah. I'll be coming back before you have bubs. But yeah, we've covered so much. It's incredible. And I'll just jump into the different comments that I see everybody's kind of flicked through here. Someone said, tag a friend and said, really worth the watch, which is awesome. Yeah, so it's amazing. People have gotten some beautiful value out of this. I've had Lindy say, wow, Pip, Sophie, it's incredible. Oh, lovely. She's heading for her 6-month postnatal appointment in a month, and she's definitely going to try and find a women's health physio. Yay! And she says, thank you for talking about C-sections. So that was, that's really helpful for her. And also realizing, like that is this, you think it's all down there, and if you've got a C-section, you should be okay. But now, like, you've just, totally opened my eyes, and I haven't even had a C-section. So I can only imagine what those women, were feeling.
Yeah.
Taryn says it's great that you've discussed this, and it's awesome to know that you can look to see what's going on and that you can fix it. And understanding that it might feel like a tampon is not inside you properly was a big eye opener for her. For Laura, she's saying she has a sleeping baby and toddler attached to her, so she can't listen right now, but she loves some more information on how to identify prolapse. She's 17 months post-birth now, which is great, everything that you've shared with us. And if I can potentially slice those snippets. We can talk to Prolapse as well, but you know, for her to see a women's health physio, because I think that sounds like, you know, something that you definitely need to book in a consult and get some help. And she's saying thank you for listing all the next steps, because it's amazing how it affects your everyday life.
Yes. There's one thing that I thought I'd just mention about Prolapse, and that's that so there are these little devices called pessaries, which, so at Unity Studios, Caitlin fits them. And they're basically like a little silicone device that's kind of, the most common one's like a ring. Yeah. And you squidge it, so you can...
Is it almost like a Hello Cup?
No, it's like a donut. Okay. But so it's a ring of a medical grade silicone that you squeeze and pop up inside yourself, and it springs open at the cervix, and it supports, if your uterus is dropping down, it can support a uterus prolapse, and it can support the anterior wall, so stop that bladder from dropping down. So that is something that so if I'm seeing someone...
But you wouldn't insert it yourself, you would get a professional to insert it.
Yeah, so you do, but so you would go and see Caitlin, and she would fit the pessary. Then she would get the women to stand up and do some squats and some jumping, running on the spot, see that their symptoms had improved, and then she would teach them how to take it out, so then and put it back in. So then they would go off to the bathroom, take it out, put it back in. They then repeat the tests. And then it's a case of just having some follow-ups with the GP, just to sort of check that everything's okay, and then follow-ups with Caitlin. And then these pessaries can be used depending on the severity of the symptoms. They can be worn all day. They can be taken out once a week and washed and popped back in, or they can be taken out every night, or you can literally just pop it in for running. So, or your exercise. So it can be that you've got no symptoms apart from...
Could you use a tampon with it?
Yes. Yeah.
Oh, amazing.
Yeah, because it's just a ring sitting at the top. So and they tend to be really good for supporting the anterior wall and the cervix. And then there are some other different types of ones that can support the posterior wall, if that's what's dropping in. There are lots of different types of pessaries. I'm talking about one that's most common. But it's essentially like having a bra for your vagina.
Yeah.
So, you know, if you were to go out for a run, but every time you run, you're getting some heaviness, and then you saw a physio and they diagnosed you with a mild, you know, prolapse, it might be that a pessary is a really great option. And you can see a physio and
so you would see your physio and you would continue to do your exercises to improve that and fix that solution, but as an interim
it's
as a supportive tool.
Some women will just have to you know, a pessary will be a good option to them to manage their symptoms long term. But if you, for instance, see a physio for a 6-week check postnatally, and they diagnose you with a prolapse, then it might be, you know, you start with your pelvic floor training, and then there's the option of having a pessary fitted, and then you're monitored over the next year to 2 years. And it might be that every checkup you have, actually, because those vaginal walls are supported, had some tissue recovery. So then it might be that the size of the pessary goes down as you get that tissue recovery. Because if your uterus is dropping or your bladder's dropping, then those tissues are always on a stretch. But if they're supported, they can recover somewhat. So there needs to be more research into this for using pessaries, you know, postnatally, and like how much the tissues can recover. But certainly with Caitlin, with the women that she sees, she often sees these women like quite soon postnatally, and they go down in their size of pessary, and some of them eventually don't need them anymore. So
that's incredible. Yeah,
you know, I just wanted to mention that is you know,
no, that's so good to know, because I often think you know, when women have had babies as well, we've all heard of prolapse. It's like that word that you hear that you're like, oh, I really hope I don't get that. And then you really feel for women who do. And it's just like one of these things that you don't really necessarily understand. And it sounds really terrible, like your organs dropping down, like, you know, and causing all these different issues. But it's so good to know that there are actual, you know, tools and you guys who can help with the different exercise and bring everything back up. And that tool just sounds amazing to be able to, you know, properly support those muscles that need to recover, because they can't properly recover if they don't have the support. So it all makes sense, and it's really
exactly. And it is really, really common after having a baby to have some degree of a prolapse, and that's not, you know, it can be really treatable. So it's scary, and it's such a taboo subject. And when you think of prolapse, you do just think of like an organ hanging out of you. But
yeah, like I kind of, you know, like I guess you can't really picture it if you've never had one as well. It's probably quite hard to really understand it. And if you do have it as well, you might kind of like, I think that, you know, like you said, just a tampon not in the right way sort of helps you visualize that it's not, you know, just an organ just
like the more severe
out of you. But
more severe ones would be, we grade them. So well, they're called different stages, so stage 1 to 4. And a stage 1, say a stage 1 of the bladder would be that the bladder's just dropping a little bit in the vagina. The stage 2, it might be dropping to the entrance or going out a little bit. Stage 3, out further. Stage 4, completely out. But we're going to see at Unity Studios, really, I see stage 1 and stage 2. You know, Caitlin, I think, sees some of the more significant ones, because she will get referrals because of, you know, she's fitting pessaries. But really, it's very common to have a stage 1, you know.
And that in its own way is just nice to know, because if you are one of those women who feels like, oh my God, why has this happened to me? Like, you know, it's nice to know that you're in a bubble. It's a common thing. Like, these things happen after childbirth. We all have issues in some way or another. And hopefully, you know, just hearing everything that you've said is hopefully like preventing that. Just on that, actually, there's the petition that you, I wanted to share with everybody about the petition, because it's so incredible that in New Zealand at the moment, there's the petition that you guys are supporting and backing, which is, you know,
more funding for women's health physios, and just put more funding in healthcare in this area, because unfortunately there isn't all the things that we've been talking about today aren't generally covered by ACC. So ACC, it doesn't provide any cover for.
And just for everyone who's watching who's not in New Zealand, ACC is basically our government's funding platform for accident related or so
if you have if you sprain your ankle, then you get 16 sessions of partially funded physio. But if you go through a C-section where that's major surgery, or you have a vaginal birth where you get a significant tear, then you get no funding, which is
like it's like what? It's quite unbelievable. I also remember fighting with my medical aid. I won't name them. But just I wasn't able to get funding to see you as a physio with my diastasis recti. They confirmed that they would only give me funding if I ended up with an umbilical hernia for surgery. And I was like, that doesn't make sense. So you want me to go through surgery? I'm confused. You know, I could prevent it.
Much cheaper. So the petition is all about trying to get government funded checks for women postnatally. So because, you know, the cost of a physio doing a postnatal check is going to be much cheaper than that woman requiring prolapse surgery in the future.
100%, 100%. It's very strange with how that system is worked up. So thank you for bringing this to light and talking about it. And it was great to see Caitlin on the show as well, the project, which is a show in New Zealand that also highlighted it. And you were there as well. You were fully in your fully in the exercise routines. So that was awesome to see, and I'll definitely share that. And I've signed it, and I really encourage everybody else to sign it too, because you know we're just in it together, and we're all supporting each other and preventing further damage down the line. So yeah, we definitely need to talk about these issues more. We need to speak about these topics and just open the dialogue, essentially. So thank you so much. And I know you're pregnant right now and possibly very out of breath. You've been amazing. So yeah, and you honestly have just shared so much. And you know, just in the time that we've been talking, we've had so many incredible comments from women coming through just saying thank you, you know, like I didn't know this, and I'm definitely going to see a women's health physio now. And you've actually just like hit the nail on the head, you know, describing what women are going through and what women are feeling. So yeah, thank you so much, Sophie. Like you really have made an incredible difference in these women's lives. And I'll share this with you as well, and they'll, you know, hopefully, you know, anyone else who wants to share the video can share the video as well. And yeah, we'll wait for you to be able to, you know, feel free at any stage to jump on in and
answer any questions, and I'll also send those resources, because there was lots of things that we kind of touched on, but if I could send you, for instance, like the exercise guidelines in pregnancy, we kind of touched on that changes throughout each trimester, so I'll send those through, and the petition and other resources. Like we've got on our website, we've got a blog which has lots of different
I did want to actually mention, I was going to say, you know, if women want to hear more from you particularly, or where do they get more from you? Where do they go?
So through Unity Studios, that's where you can find me.
And on Instagram, your Unity Studios NZ?
Yeah, on Instagram and Facebook, Unity Studios NZ. And then I have my Instagram page, which is Sophie Lax Physio, which, I'm still sort of just getting to grips with.
I'd say you have your hands pretty full.
Not the best on Instagram, but yeah, so Unity Studios is definitely one to follow. And then on our website we've got a blog where that Caitlin started writing, so it's the Vagina Physio. She's written most of them, and it's fantastic, and she goes through all of these sorts of topics, lots of advice and education. So I'd definitely have a little look at that if you want to.
No, for sure, and I'll share the links as well. But it's been honestly phenomenal having you over here, and thank you so much for being so open to share your time with us and to discuss all these topics openly, because we've all learned so much. And I know that I'm going to get, you know, I've had other messages kind of like popping up on my phone that I've seen, and I'm like, I've just ignored the phone right now. But I'm sure there's been some comments that have come through from people who have been like potentially watching, or who might come up with a question later at some stage. So feel free to, you know, comment or post anything in the group as well. It's your space too. So we're so lucky to have you in our circle, in our wild mama circle. And we can't wait for you to become a mum, you know, so. That's what I preach. You know what? The whole thing in this group is just embrace the wildness, because there's just so much that crops up that you honestly couldn't believe happens to you. And particularly, you know, prior to being a mum and then becoming a mum, you're just like, what? This is my life now? Like, what? Yeah. It's just, it's the most amazing, you know, most amazing opportunity, you know, to become a mum and to have an influence over these little people's lives that you just, there's no other love like it, you know, and you've probably been told that a zillion times. But it is also just this complete whirlwind of, you know, emotions and just juggling. So that's what this is for, you know, for us to learn from you incredible people and to help us just, you know, with all the different ups and downs and struggles that we do go through, to know that we don't need to suffer through everything, you know, because we already have our mum hat on and we're already trying to do a whole lot of different things and focus on baby, but to know that there is help for us. And if we can just take away a few of our struggles or a few issues that could be easily resolved, you know, by seeing a women's health physio, for example, or, you know, knowing about the fact that you guys exist and actually being able to go away and get a bit of help there will make a huge impact on our lives in other areas and just managing our day-to-day lifestyles. So yeah, really.
Such a pleasure. My
Thank
first
you.
Facebook Live, Insta Live.
Well, you have kicked off. So thank you so much, and yeah, we'll be in touch.
Yeah, lovely to chat.
Well, have an amazing afternoon, and go grab some water now. I'm sorry if I've totally derailed how you're feeling.
Okay. Bye.
Bye. Thanks, Soph.